All right, Greg, so today we are going to do the examination for your abdomen. So first we start out with just general inspection, looking at hair patterns, any moles to be concerned about, any markings on your skin, any lines. Also, if we were to see a visible mass, we'd have the patient turn their head and cough, checking for a hernia. Everything looks good on you. So with the abdomen, we start out by auscultating because you don't want to move anything around. And so we start out by using the diaphragm, and we start in the right lower quadrant unless there's pain elsewhere, but he doesn't have any pain, so we're starting in the right lower quadrant, and then you listen for 5 to 15 seconds in each quadrant for bowel sounds. Okay, and I heard stuff moving around in there, which is good. Nothing's hypoactive or anything like that. So then we're going to listen for bruits over the artery. So we're going to start out at the abdominal aorta, which is right along the line of the umbilicus. And then we'll do the renals, which is up 1 over 1 from that spot. Then we'll do the iliac, which is down 1 over 1 from where you started. And then we'll also do the femoral. So I'm going to go skin on skin along your pant line if that's okay. Okay, and then we're also going to listen over the liver and the spleen for any problems there. All right, and everything, I didn't hear anything for the bruits, so we're good there. And then we're gonna go into palpation here. So first we will listen by tapping for the borders of everything, and also just to check and see if there's anything normal. So I'm gonna run down the axillary line. Hands are a little cold. Okay, and then we're going to find the borders of the liver and the spleen. So we're going to go down from the base of the nipple. It's going to go resonant to dull. Just like right there. Then you go up from the umbilicus to the liver, which would be from tympanic to dull. Just like right there. And it should be a normal 6 to 12 centimeters. And then for the spleen, we go around the last intercostal space. I'm sorry, my hands are still cold.
Yeah.
Should be right there. And so we know where that's at. I didn't hear anything abnormal, which is good. And then we will palpate the abdomen area, starting in the right lower quadrant, just on the edge. And if we were to feel, we go in a clockwise position through all 4 quadrants. And if you were to feel an abnormal lump, you'd have the patient turn and cough, checking to see if that was a hernia as well. And then you go through one more time a little bit deeper. Okay, and then you'll also feel for the pulse of the aorta, the abdominal aorta. You do that bilaterally. There it is. Okay, and then we will go into, palpate the liver. So you do kind of a hook formation with your hands around the ribs, and then you have the patient breathe out. And as they breathe out, you go a little bit deeper, and then have them breathe in. And if that was to cause pain, or if they were unable to do that, that could indicate a problem with the liver. And then for the spleen, we'll do the same technique. So I'll have you breathe out. That way I can get deeper, and then have them breathe in. And if I were to feel the spleen pop up and hit my finger, or if it was painful, that could be splenomegaly. We do the same for the kidneys as well. Just put the hand behind the back. Breathe out. Okay. And usually you can only palpate kidneys on super thin people, so. Okay. I didn't feel anything on the kidney part, so he's safe there. And then we will check for the liver. It would have been a positive Murphy sign. Then we'll check for an appendicitis. Can't remember the dude's name. It starts with the M, but McBurney sign. And that is, you find the ASIS and the umbilicus, and you go halfway between there and apply pressure. And if there was pain there, that could be positive for an appendicitis. Or we'll do Rovsing's sign, which you go to the left lower quadrant and apply pressure. And if it was to refer pain back to the right lower quadrant, that could be appendicitis. Or you do the referred rebound test, where you just remove your fingers a little more quickly. And if it was to refer back to the right lower quadrant, that would also be positive for appendicitis. And then if it was painful on the left side, that could be diverticulitis. And then some special tests we'll do here. We'll do the psoas and the obturator. So flex the patient's knee and have them push into your hand as you push out. And if that was to cause pain for the psoas, if it was to cause pain in the right lower quadrant, that could be an appendicitis. And then also the obturator test, you just turn internally rotate the patient's leg, and have them push against you. And if that was to cause pain in the right lower quadrant, that would be a positive sign for possible appendicitis as well. And that concludes the abdominal exam.